everyone. Welcome to our presentation today on Medicare. My name is Brenda Rolli. I'm an accredited asset management specialist with Provident Financial Consultants. We have learned at Provident that education is very important to our clients, and that is why we are offering these monthly webinars. So let's get started with Medicare. This presentation is meant to help people start off on the right foot as they prepare to enroll for Medicare benefits, but your best source is always going to be found on Medicare.gov. This will help you familiarize yourself with some of the basics today, but it is not meant to cover everything. And as with any government program, there are always exceptions to everything. So Medicare is a federal health insurance program that will be eligible for people who are 65 and older generally. Again, there are exceptions. Our agenda today is going to cover when to enroll, Medicare overview. Again, as I said, it's not a comprehensive talk about Medicare, but it is going to be a broad overview of Medicare and what it involves, healthcare costs, and guides to selecting the best coverage. So when are you eligible to enroll for Medicare? Well, if you are already retired, meaning you are already collecting Social Security, good news, you don't have to do a thing. You will automatically be enrolled in Medicare. You will receive your welcome packet 3 months before your 65th birthday. And again, you don't have to do a thing. However, if you reach age 65 and you are not already collecting Social Security, you will need to enroll during your initial enrollment period. And what is that? That is the period 3 months before you turn 65, the month you turn 65, and then 3 months after you turn 65. If you miss this initial enrollment period, you may be subject to late enrollment penalties, which you definitely don't want to incur because they are permanent penalties. And it is 10% of your Part B premium. There is, of course, an exception if you are still working and covered by an employer plan, which we'll get to in just a second. Also, you want to, at this time, sign up for a Medicare supplement policy. It states here within 6 months of the month you turn 65, but really you want to do that as soon as you start Medicare benefits in order to be guarantee issue. What does guarantee issue mean? This is a period where they can, the insurance companies cannot ask you personal health questions. You're going to be treated the same if you have pre-existing conditions or not. So what if you want to work past age 65? When do you enroll in Medicare? There is a special enrollment period for those of you. And the first thing you want to do is to check with your employer to see if you need to sign up for Medicare Part A. Not every employer requires that, but a lot do. So you definitely want to check with them. You don't need to sign up for Medicare Part B until you have a qualifying event, and that's what the special enrollment period is for. Your qualifying event is when you retire or your spouse retires if you are covered by their employer plan. Once again, you need to sign up within 8 months from when your employer coverage ends, and you will be subject to permanent penalties if you don't. You want to make sure that you have had credible coverage prior to this. Credible coverage means that your employer had 20 or more employees, offered a group health insurance plan, and also offered drug prescription coverage as well. You'll also want to look at signing up for Medicare Part D prescription drug coverage. You must sign up for this within 63 days of having that credible drug coverage to avoid penalties. Now, remember, these timelines are when you must enroll. However, you should sign up prior to retirement from your employer, whether it's at age 66, 67, you don't want to be without coverage. So again, your special enrollment period, it begins anytime that you have the qualifying event, which would be ending your employment. You want to start Part B within 8 months. In my opinion, you want to begin as soon as your employer plan or your spouse's employer plan coverage ends, and Part D within 63 days of having credible drug coverage. Once you enroll in Medicare, either A or B, it disqualifies you from contributing to your health savings account, okay? You need to think about that when you're receiving Social Security and turn 65. Because you are automatically enrolled, stop contributing to a health savings account. Contributions can still be made based on the family maximum. They will include the Medicare beneficiary. So you'll still be able to do that. And you'll also be able to take distributions from your health savings account. So all this time you're working and contributing to your health savings account, you can now use these funds to pay your Medicare premiums. You cannot use those funds, however, to pay for a Medicare supplement plan. So now that we have the enrollment covered, what are your Medicare options? You have 2 options to choose from. One being original Medicare. This is Part A and B. And then there's 2 add-ons. One is Medicare Part D, and the other is the Medicare supplement policy. Those 2 are issued by private companies. The other option is going to be Medicare Advantage Part C. This is a private company, but it is also governed by the government. They determine who is going to be able to offer these Medicare Advantage plans. You may or may not need to add on the Medicare Part D prescription drug coverage. It depends on which plan you choose. So let's get into what each covers. The original Medicare Part A and B, and then again, if you add on D and the supplemental plan, consists of Part A, which is your hospitals, hospital coverage. So think of this as inpatient hospital stays, skilled nursing facility, which will cover for 100 days after a 3-night stay. Now, I'm sure a lot of you have heard about this. You want to be admitted to the hospital. If you are in the hospital for, say, observation, it's not going to be covered. So you do not want to be admitted under observation. And also Part A covers some hospice care. Part B is your doctor visits. So think of this as outpatient services, some home health visits. You're also going to receive your preventative care here. Screenings, mammograms, blood work, things like that is Part B. Part D, again, optional. This is your prescription drug coverage offered through a private Medicare approved insurance company, as well as your MEDIGAP, as we say, the supplemental insurance, again, optional. And they are also available through the private insurers that are approved by Medicare. This plan is going to help with those out-of-pocket costs, deductibles, and copays that apply to Part A and B. Your option 2 coverage, as we talked about, was Medicare Advantage, also known as Part C. Now, this includes Part A and B. So everything that we just talked about in A and B is part of Medicare Advantage, but they usually also cover your prescription plan, your Part D, through, again, a private Medicare approved insurance company. Some Medicare Advantage plans will also cover vision, dental, and hearing, including hearing aids. Original Medicare AB does not cover vision, dental, or hearing care hearing aids. So what are Medicare supplement insurance, also known as MEDIGAP plans that we keep talking about? Well, these are private insurance policies that you will purchase through an agent. They, of course, are Medicare approved, and they're designed to help pay healthcare costs that original Medicare doesn't cover. Also, to cover co-pays and deductibles that are associated with Part A and B of original Medicare. Prescription drug coverage is not included under our policies for Medigap or Medigap policies sold today. So you want to make sure you sign up for a Part D prescription drug plan. You want to also sign up for this Medigap policy, as we talked about, within 6 months. My advice to you, sign up before you are going to receive Medicare Part A and B, so that there's continuation of coverage and that you ensure guaranteed issue. Again, very important, because they can't, the insurance company can't ask you any healthcare questions. They do need to insure you regardless of your health condition. Remember, you can't use HSA funds to pay for the Medicare supplemental premiums. Medicare Advantage Part C, again, are offered by private companies. As we said, they do cover Parts A and B. So you're going to get the same coverage that you would on original Medicare. Some plans offer the prescription drug coverage. Some plans may require you to pay additional premiums. So you're still going to pay with a Medicare Advantage Part C, Part B premium. That's going to always be something that you have to pay, but you may have to pay an additional premium depending on the plan. Some Medicare Advantage plans don't charge any premiums, while others do. You still must meet your Part A and B deductibles. So again, everything works with that hospitalization and your doctor visits the same as original Medicare. Medicare Part C, Advantage Part C, does require you to work within a network of available doctors. So this is very much like your HMOs and PPOs, preferred providers, that you have or may have with your current insurance. There is a maximum out of pocket that a Medicare Advantage Part C plan can charge of $7,550. That does not mean that all plans have that high of a maximum out of pocket cost. Some plans will have a much lower maximum out of pocket cost. So all of these costs are going to vary depending on the plan you choose and, of course, where you live. So different regions in Wisconsin offer different types of plans. Someone living in Milwaukee is not going to be offered the same Medicare Advantage plan that someone who is living in Oshkosh will. There are differences depending on the region in Wisconsin of which you live. Let's talk about the costs associated with Medicare. So some key terms to be familiar with are the deductible. This is the amount you must pay out of pocket before your insurance company will pay any expenses, similar to insurance you have now. Then we have your copay or co-insurance. They mean the same thing. This is what you will have to pay. Once you've met your deductible, you're going to share in the costs of any covered medical bills that you receive. Premium, we're all familiar with this. This is the amount of the insurance company charges to cover you. So let's look at some of the premiums associated with Medicare. Part A premiums are based on quarters of coverage. Generally, you do not pay a monthly premium for Part A. The only time you would pay a premium is if you didn't work at least 30 quarters paying taxes into the program, or something similar to that. But for most people, you do not pay a monthly premium for Part A. So you'll often hear people say Part A is free. Well, no, it's not really free, because you paid in your whole working career to Medicare. So now you're collecting those benefits. There are, again, deductibles for Medicare Part A. In 2021, the deductible is $1,484 for each benefit period. What is a benefit period? Your benefit period begins the day that you are in inpatient care and ends when you receive no care for 60 days in a row. So that is a benefit period. When you take that into consideration and understand that, you realize that you could have 2 or more benefit periods in a calendar year, right? So you go into the hospital and you're in for 7 days, then you don't have any needs for care for 4 months, but then you end up in the hospital again. That starts a new benefit period. So the deductible for each benefit period, again, is $1,484. After that, your copay starts. So your copay for inpatient hospital stays, days 1 through 60, 0. They're covered in full. However, after that, days 61 through 90, you're going to pay, this is for 2021, $371 per day. After that, if you are still in the hospital after days 90, starting on day 91, it's going to be $742 a day. This is when you are in what is called your 60-day lifetime reserve benefit. This is a period of time, 60 days, where you use anytime you are an inpatient at a hospital in excess of 90 days. You get those 60 days as a lifetime. So say your first hospital stay would be this long, you could use 5 days and you're discharged. You've used 5 of those 60 lifetime reserve days. So that's what that means. Let's look at skilled nursing care, okay? And it says long-term care. We are not talking about the same long-term care as long-term care needs, assisted living, anything like this. This is something completely different. But those days 1 through 20, you have 0 copay, it's paid 100%, and then days 21 to 100 are $185.50 per day is what your copay is going to be. After that, you will pay 100% of the costs. That's Part A, that's your hospitalization. Again, there are no premiums for Part A. Part B, we have monthly premiums that are based on income. So for instance, if you are single, making $88,000 or less, your monthly payment premium is going to be $148.50. That's that top roll, whether it's filing joint tax return, married and separate return. The minimum you're going to pay is $148.50. So what if you are single, making $130,000 a year? Well, you're going to pay $297 a month for your Part B premiums. Now, of course, there are some exceptions, of course, to every rule here. Medicare looks back at your modified adjusted gross income from your tax returns 2 years. So they're going to look at, for instance, if you are enrolling, you're 65 this year, they're going to look back at your income back in 2019 for these numbers. That is going to determine what your monthly premium for Part B is for the next 2 years. Things to consider when you are approaching 63. If you are in the process of selling your business, for instance, how can you navigate that so it may or may not affect your premiums? What about sale of land? Roth conversion, something to be very much aware of if you're converting your IRA to a Roth pre-retirement. This is something that you want to look at as you approach age 63 so that it does not impact your premium for Part B. Sometimes there's no getting around it, but sometimes just talking to someone and looking at some strategies to help mitigate additional income is going to be beneficial. There is, we call this IRMAA because this is what dictates your Medicare Part B premiums, and as you'll see later, also your Part D prescription drug premiums. If there is something that is a one-time event or that you don't agree with their determination, then you will get this notice included with your determination that your premium is going to be higher. You can request what's called a new initial determination. This form, SSA-44, will be used to do that if a life-changing event has occurred. So, for instance, your premium is based on your income 2 years ago, right? For someone this year at 2019, a single person earning 130,000, or for a joint return, 2 people earning 250,000, your premium is going to be $297. For joint, that's per person. But since then, you've retired, you stopped working. So say in 2020, you were no longer working, your income was much less, you can submit this application, this form, to show them that there is a life-changing event. You didn't have that type of income, you stopped working, and they'll look at that and determine if your premium should then be reduced to the $148.50. So something to be aware of. We can look at, as I said, mentioned earlier, strategies that can reduce or eliminate IRMAA surcharges. Making qualified charitable distributions is one of them. Looking at your Roth conversions, as I stated earlier, you could even defer Social Security benefits until age 70 if your Social Security income is putting you slightly over that income threshold. Tax loss harvesting, just to name a few. So that there's really quite a few options out there that you might want to talk to someone about as to how you can reduce those surcharges. Again, if you are subject to them, they will last 2 years, and then they'll look back. So 2 years from now in 2023, they're going to look back at 2021. If your income has dropped considerably, so will your Medicare Part B premiums. So what is covered by Medicare Part B? We already talked about the preventative, medically necessary, your doctor visits. So this is what you should think of when you look at Part B. You'll typically owe 20% of Medicare approved costs. So when we were talking about co-payments, that is what you should expect with Part B, is about a 20% of the approved costs. The annual deductible here, unlike Medicare Part A, is $203. So that's it. Once you've met that $203, which really, how hard is it to meet that deductible, then you will have to pay 20% of the cost going forward. So again, monthly premium on the low end, $148.50, but it could be as high as $505 for some people with higher incomes. Part D, as I said before, again, this is going to be the premiums based on your adjusted gross income. They look 2 years back. So this is something that you want to be aware of when we're having those one-off events, whether selling a business or land or something like that, that can drive up that income. Now, the plan premium averages $30.50 a month, but you're going to have that surcharge again if your income is above the thresholds. So if we use our example of a single person who earned $130,000 while they were working, or later due to some other circumstances, and a couple filing joint $250,000, you're going to pay that $30.50 and an additional $31.80. What does Medicare Part D cover? This is going to cover, as we said, prescription drugs. You want to choose a plan that is going to cover the drugs that you currently are taking or that you anticipate you may need. So different plans are going to cover different drugs. So you want to make sure that you look at the list that's available out there, and the ones that you're taking are in your plan. Also, it's going to be determined the cost by the pharmacy. You want to choose the plan that your pharmacy is in their network. You're also going to have copays for prescription medication for Medicare Part D. This is where Medicare supplement plans come in. For original Medicare, this is another add-on, and these are meant to cover those costs, those copays that we just talked about with Part B being the 20%, copays with Part A, and also deductibles. So that's what MEDIGAP is meant to cover and provide for. MEDIGAP policies range anywhere, it says on this slide, $90 to $110 a month. However, this presentation is a general presentation. We in Wisconsin do not have the standardized Medicare supplement plans that the rest of the nation has. Matter of fact, there are 3 states that do not follow the standardized Medigap plans. Wisconsin, of course, being one of them. So when it's talking here about Plan G, that does not apply. Also, our premiums can run 90 to 110, but also anywhere up to $200 a month, depending upon the riders. So Wisconsin has a basic plan, and then you add additional features or riders to them. So that is going to help reduce the out-of-pocket expenses. But again, the policy, the premiums can range much higher in Wisconsin or even in Oshkosh, anywhere between that 90 to 200, depending on the benefits you add on. Part C, so we're switching over to your other option. That first part was all about original Medicare. A, B, your add-on for prescription drugs and a Medicare supplement plan. So now we're going to get into Part C and the monthly premiums. The Advantage Plan premiums, again, we mentioned, are in addition if you do have to pay for Part A. Again, most of you do not pay for Part A, but they will be in addition to your Part B premiums. The average monthly premium is $21 a month, but it can range here in Wisconsin, generally $0 to $21 a month. They do not go up as high as that $200 a month premium generally in Wisconsin for the Part C. Lower premiums could mean higher deductibles and higher out-of-cost pockets, so you want to research the Medicare Advantage plan that is available in your area. So how do we select the best coverage between original Medicare or Part C, the Medicare Advantage? There's a few factors to consider, and those are, again, the cost. So what is a Advantage plan going to cost? The deductibles, which are your out-of-pocket concerns. Your personal health, again, when you're working, you chose a plan possibly if you are relatively healthy, don't need to see a doctor often, a plan that the premiums lower, the deductibles higher, but that works for you because you don't need care very often. While a person who may have a chronic condition is going to pick a policy that is going to maybe cost a bit more, but they're not going to have to pay as much in co-payments. So those are things to consider when you're looking at Medicare versus the Advantage. Travel. Is your plan going to cover you if you travel outside of the region? Remember, Medicare has HMO, PPOs, some plans, it doesn't matter if you go out of network, the cost or deductible is the same. Others may charge more if you go out of network. So if you're someone that travels quite often, that's something to consider, as well as any other coverage and conveniences that may apply to the specific plans that you're looking at. When we look at cost, there's this here that we can look at to look at what may be better for us. The original Medicare, adding D, making that assumption, and a MEDIGAP policy compared to the Advantage plan. Again, remember, Advantage are Part A and B are part of your Advantage plan. So Part A, we're going to assume free for most people. Part B, you have the minimum of $148.50. It's going to be higher if your income was higher. Part D, we're looking at the minimum as well of $30.50. You're not going to have Part D with an Advantage plan. Remember, they include the prescription drug plans. And with Medicare, original Medicare, most will elect to have a Medigap or supplemental policy to cover those deductibles, out-of-pocket expenses. That is something that you don't have with the Advantage plan. So total premium without A is what we're going to look at, is going to be about $269. That is assuming your Medigap plan is $90. Remember earlier I said that in our area, you're looking at probably more around $100 to $200 for that premium. And then we look at the Advantage plan, the total monthly premium without could be about $170 a month. Again, as I stated at the very beginning of the presentation, this is an overview. There's assumptions made to the Medigap and Advantage plans as far as cost in your region. Out-of-pocket expenses to look at. There are no out-of-pocket maximums when we're looking at the original Medicare. There's premiums, co-pays, co-insurance deductibles, of which we talked about. You can go just about anywhere in the US for care. So most hospitals accept Medicare, and you should have no problem when traveling within the US as to where you receive care and where your services received are covered. You, however, may need to get a standalone vision plan. Hearing, dental are not covered as well. And you may need to get additional travel insurance depending upon your Medigap policy. The Advantage plan maximum out-of-pocket is limited. Again, in Wisconsin, in this area, those maximum out-of-pocket limits are lower traditionally. You do, again, have premiums, co-pays, co-insurance, and deductibles, the same as Part A and B. And you may have additional costs if you go out of network. So quick comparison between the two. The HMO and PPO is going to depend which plan you go with. So again, something that you really want to sit down with someone, talk to them, an agent that will go over the differences for you. Can you see any doctor? That is one thing that is very different. Again, any place in the country, if they accept Medicare, which the majority of hospitals and clinics, physicians do accept. Medicare Advantage, HMO, PPO, depending upon the plan you get, may or may not be in that network, and you may have a higher cost, again, depending on the plan. So do you need to be referred to a specialist? With original Medicare, you don't. With the HMO or PPO, you may have to, but again, it depends on the plan. So best advice is to, look at the different plans with your Medicare Advantage options to determine if that is right for you as opposed to original Medicare. And it could simply depend on the area in Wisconsin of which you live. Remember, you may need to look for additional coverage with original Medicare. It does not cover vision, dental, or hearing. So hearing aids can be quite expensive. That's something that you may need to get a standalone plan, or if it's very important to you, maybe something that you look at the Advantage C or the Medicare Advantage Part C plan to get coverage for that. You can use your funds from your HSA, remember, for any of these co-pays, deductibles, out-of-pocket expenses can be used by your HSA. Remember, the only thing you can't use your HSA funds for is your supplemental insurance plan premium. So I think with that, we have covered a lot of information. There is a lot, it's a government program. there's a lot of moving parts to it. So I hope that this gives you at least a place to start. If you have more questions, feel free to email us at info@providentfc.com, and I will get an email back to answer those questions to you. Again, feel free to contact us. We have a resource here that can go into deeper details about the different plans in the area and to give you just a broader overview of what we talked about today. Otherwise, an agent will, be happy to go over that with you as well and explain the different options based on your particular scenario. So with that, I thank you very much for attending, and we will see you next month.